You are dispatched to stand by at a structure fire. Suddenly, firefighters emerge from the residence with a 40-year-old female who is coughing violently. She has second-degree burns to both hands and forearms and on her abdomen. She is alert and having mild difficulty breathing. How would you best manage this patient?
Alright, I'm going to go ahead and start with by putting on my BSI precautions. Is the scene safe?
The scene is safe.
Alright, and then I'll enter the scene. The mechanism of injury is the fire, in which the firefighters pulled the patient out. There only seems to be one patient, is that correct?
Yes, only one patient.
Alright, I'm going to go ahead and also call additional EMS assistance, and I'm going to layer the patient down, but however there was no falling injury or no head injury, so I'm not going to go ahead and stabilize the spine. My general impression is a 4-year-old female who suffered second-degree burns on her forearms, hands, abdomen, as well as there is some coughing. I'm going to go ahead and enter the scene. Hello, I'm Carl, your EMT today. How are you?
Burning and coughing.
Alright, the chief complaint of the patient is she has the second-degree burns to hands, forearms, and abdomen, as well as some coughing. She is also alert and oriented. I do see second-degree burns on said areas, and it could be possibly a critical burn. So I'm gonna go ahead and rinse the areas with some water, not ice water, to avoid damaging the tissue further. So rinse abdomen and forearms. I'm gonna head and also now with sterile gauze dressing wrap the forearms and the abdomen. This to avoid any contamination of the arms as well as keep it safe. The patient did not too long ago speak to me, so from my understanding that the patient's airway is patent and secure. The breathing seems to be labored, however, the chest is rising equally and bilaterally. And I am going to go ahead and administer oxygen via non-rebreather just to be safe because of possibility of inhaling carbon monoxide, smoke, or any other toxins in the fire. I will go ahead and check the pulse. Normally I would do the carotid, but I do not want to injure the patient. So I'm going to, radial, and then I'm going to do the carotid so I don't do the injury. Alright.
You get 86 beats per minute.
Alright, 86 beats per minute. And then I will also, I'm checking for any major signs of bleeding, and there doesn't seem to be, is that correct?
Yeah, no signs of major bleeding.
Okay. The skin is warm, dry, and slightly flushed, is that correct? Besides the burn areas?
Mm-hmm.
Okay, and then also I'm gonna, because there are burns on a possibly critical amount of the body, so I'm gonna go ahead and transport the patient just because I want to make sure that I go ahead and treat for shock, or to make sure that the patient doesn't go into shock. As we're transporting the patient, I'm going to go ahead and get your history, okay? Do you have any allergies?
No.
Any medications that you're taking?
No.
Any past burn history that you've?
Nope.
Okay. When was your last oral intake?
Like 3 hours ago.
Okay, and what were you doing before?
Smoking a lot.
Smoking a lot. Okay, I'm going to go ahead now and go ahead with the secondary assessment. For the rapid secondary assessment, I'm going to use the acronym DCAP-BTLS. That stands for deformities, contusions, abrasions, penetrations, burns, tenderness, lacerations, and swelling throughout the whole body. Alright, I'm going to go ahead and start with the head. I'm palpating the back of the head, as well as the top of the scalp. Do I find anything?
Nothing abnormal.
Okay, I'm going to go ahead and palpate the cheeks, the jaw, and the chin. Do I find anything?
Nothing out of the ordinary.
Alright, I'm going to check the backs of the ears. It seems to be normal, is that correct?
No bleeding.
Okay. I'm going to go ahead and open the mouth. There doesn't seem to be any blood in the eyes, or the nose, the mouth, or the ears. Is that correct?
They're fine.
Okay. I'm gonna go ahead and test the eyes for the pupil. How's the pupil reactivity?
Yeah, they contract as expected.
All right. I did also know that there is some carbon burning in the mucus, as well as a little bit of smoke emanating from the breath of the patient. So this is due to the fire in the building. All right, I'm going to move down to the neck area, and there doesn't seem to be any JVD or deviation of the trachea. Is that correct?
That is correct.
Okay. I'm going to go ahead and gently palpate the back of the cervical spine. Is there any
No abnormalities.
Okay. I'm going to move on to the chest area and go ahead and palpate the chest of the patient. It seems to be normal. Is that correct?
That is correct.
All right. I'm going to go ahead and also auscultate the patient in 6 different regions of the chest. The chest seems the breathing seems to be slight wheezing, but however, no diminishing sounds, and it seems not very going due to the non-rebreather working. Is that correct?
That is correct.
All right. I would palpate the abdomen, but there are second-degree burns, and I don't want to cause further damage, so I'm going to go ahead and bypass that until we get it to the hospital. I'm going to then move on to the pelvis of the patient to make sure everything is in place.
It is stable.
Okay. The groin area also seems to be normal. Is that correct?
Yep.
Okay. I'm going to now go ahead and move on to both the legs, lower extremities.
You don't find anything abnormal.
Okay. I'm going to do make sure there's a responsive test for the patient. Can you please push, ma'am? Could you please push down on your feet? Okay. Now pull up. All right. There seems to be also a pulse on the feet, so that I'm assuming is the pulse still the same?
Yeah, the pulse is the same as before.
Okay. I'm also now going to move on to the arms. But be careful about it because there are secondary burns on the forearms and the hands. Besides the second-degree burns on the forearms and hands, is the arms okay?
Yep.
Okay. I would also do a squeeze test with my fingers, but the patient has I've applied dressing onto the patient, and I also don't want to create further injury for the second-degree burns. After that, I'm going to check the vital signs of the patient. I'm going to go ahead and check the blood pressure first.
You get 110/70.
Oh, well, I just checked the blood pressure, but however, I'm going to go back one step. I'm going to go and loggle the patient. Ma'am, can I cross over your arms? I'm going to just softly loggle the patient so not to hurt the arms or abdomen. And I'm checking the thoracic, the lumbar sacral, coccygeal spine. Does everything seem to be normal?
Everything is normal.
Okay. All right. Sorry, man. All right. The blood pressure, I assume, is still the same from what I checked not long ago?
Yes.
Okay. I'm going to recheck the pulse.
And you get 86 beats per minute.
Okay. And now I'm also going to check the respiration rates.
24 per minute.
All right. Because there are enough second-degree burns on her body, I'm going to go ahead and reassess every 5 minutes just to be safe, especially if there's a possibility of hypovolemic shock. After that, we're going to transfer the patient. I'm going to give him my full report to the next EMT, the next group. So the patient, 40-year-old female patient, suffers second-degree burns on her forearms, hands, and abdomen, and has heavy breathing, but we've stabilized it with some non-rebreathing mask, and everything seems to be normal besides the injuries, and she's alert and oriented. So, yeah.